So to introduce myself, my name is Rowan Dunn. I'm EU Advocacy Coordinator of Global Health Advocates' EU office. For those of you who don't know us, GHA is a French NGO whose mission is to carry out political advocacy at both French and EU level to ensure that policies and resources are effectively addressing health inequalities. So to maybe dive into the subjects, so this webinar comes, as most of you will know, 1 month before the next summit being held between the European Union and the African Union, which is due to take place in November in Luanda. Now, 2025 is a bit of a special year for the partnership because it marks the 25-year anniversary of the partnership. Now, at a time of historic inequalities around the world, the summit does represent a bit of a key opportunity to make progress towards accessible, affordable, and sustainable healthcare, which we will hear a bit about in a few moments with our speakers. Now, in anticipation of the summit, so GHA has worked very closely together with partner African NGOs from the Action Partnership to reflect on health within the partnership. And we have gathered some insights from 5 African NGOs in both Anglophone and Francophone Africa. So Asad from the Ivory Coast, Sitam Plus from Zambia, HDT in Tanzania, Kanko in Kenya, and also Waki Health, which is multi-regional, of whom we have a Fitsum with us here today as one of the speakers. Now, the aim of these reflections was to see what is needed to see tangible progress in health within the partnership. So for those of you who don't know it, Action is a partnership of locally rooted organizations around the world that advocate for life-saving care for millions of people who are threatened by preventable diseases. Now, all of this collaborative work has resulted in a document, in an advocacy brief, which is now available online on GHA's website. In a moment, we'll have the QR code that will appear in a moment. And I'm very pleased to be joined today by 4 expert speakers for what I'm sure is going to be a very interesting and exciting discussion. To our participants, please feel free to ask questions in the chat during the discussions, but please do make sure to specify who your question is addressed to. Now, maybe before we move to this, I would like to invite Fitsum from Waki Health to tell us a little bit more about the brief that I've mentioned in itself. So now I can see that you have the QR code on the screen. Now, Fitsum currently works with Waki Health as the African Union liaison manager, and he also coordinates the African Civil Society Platform for Health, which is known as CISPA. He represents Waki Health in different technical working groups, including the specialized Technical Committee for Health African Leadership Meeting, and as a member of the Health, Nutrition and Population Partnership within the African Union, among others. So maybe if I can turn to you first, Fitsum, it's really lovely to see you today. Maybe you can tell us a bit more about why there are expectations from African CSOs on the summit, and what these expectations are, or what they could be in terms of commitments.
Thank you very much, Juan. First of all, I would like to congratulate GHA for leading us in coming with a very important document that summarizes the current context of global health and also what the architecture should look like moving forward. So a very well-deserved thank you. Coming back to the question as to why civil societies are expected. I believe from historical experience, we have seen civil societies have been very much on the equity side of health interventions. Usually disengagements or within the health consultations are usually overlooked when it comes to the equity side of that engagement. And civil societies and communities being part of also, or being on the ground and really having the first-hand experience of the benefits and the challenges of health interventions has really kind of shaped our approach in defining the narrative of equity within these engagements. Usually, looking at the different bilateral engagements, we see the numbers, we see the commitments within time frame of years, and also the amount of resources that flow into it. However, usually the overlooked aspect of it is how communities are equally taking advantage or are being treated in the same manner. So definitely that would be one. The other area would be civil societies and communities have very much also been very loud and very much also instrumental in service delivery, very much instrumental also in advocacy front, whereby bringing the different aspects of communities, bringing the experience of communities, and at the same time also bringing the collective voice of civil society and communities to the table. Those would be very much also important in shaping the current global health architecture discussions, and also trying to understand how we define further moving forward. Well, the time, as we know, is not really the problems that we are having. ODA withdrawal, the debt crisis, and also the unprecedented US funding withdrawal has led us to where we are in terms of the health crisis at large, especially in LMIC. So very much also looking into how we can do that. The other would be bringing the component of international solidarity within our engagement. Civil societies are not really defined by borders, which also bring another element of partnerships, whereby all civil society, for example, we have having this conversation from EU, AU, and other parts of the world. And the beauty of civil society and communities is that we are not defined by these borders, and we can do a lot in terms of addressing the challenges, in terms of guiding policymakers and other international partners on what should be done moving forward. So it's very much important for civil societies to be in these conversations, to bring out the elements which are oftenly oversighted or not discussed. In terms of maintaining international solidarity is very important. Increasing domestic resources is very, very key and important. We understand the support of the EU and other partners is catalytic, is not sustainable. But at the same time, we also need to make the most out of this catalytic investment to ensure there is sustainability moving forward. And at the end of the day, of course, the question of equity, making sure that all community are served equally, irrespective of their geographic location or irrespective of their social barriers and such. Thank you.
Thank you, Fitsum, for that fantastic introduction. So maybe now, moving from an African CSO perspective, obviously also coming from you, Fitsum, as someone who works very closely with the African Union, maybe now we can move, so shall we say, to the EU's perspective. So we're joined today by Mr. Asad Beg, who's a senior expert on Pan-African affairs and team lead on EU-AU affairs at the European Union's External Action Service. So Asad has over 30 years of working within the EU institutions. He's worked with the European Court of Justice, the European Commission, the European Parliament, and also spent time as head of finance, contracts, and audits at the EU delegations to Kazakhstan, Kyrgyzstan, and also in Tajikistan. He's also worked as a legal advisor for police and judicial reform in Iraq and Palestine, and as desk officer for China and Mongolia. So his last posting was as a minister councillor, as head of political affairs at the EU delegation to China, after serving as deputy head of the EU office to Hong Kong and Macau. And on a more personal note, he really loves languages. He speaks English, French, German, Russian, Urdu, Hindi, and studies classical Arabic and Mandarin. So maybe now moving to the topic itself. So once again, thank you very much, Asad, for making the time to join this discussion. We realize that 1 month before the summit, it's a very busy time for everyone. So I just want to come back to President von der Leyen's State of the Union speech last month in September, when she mentioned that the EU is ready to lead in global health. Can you tell us a bit more about how this political ambition is going to be translated into the upcoming EU-AU summit next month?
Good afternoon, and thank you very much for inviting us and hopefully creating a safe space where we can discuss all of these issues. I'd just like to start with a small quote. Health is not a privilege of geography, it is a right of humanity. And Europe and Africa must walk this path together based on the principles of equity, solidarity, and human rights. And I think those will be some of the principles that will guide us as we prepare for this summit. I'd like to see the initiative that has been made by President von der Leyen at the State of the Union for a new global health resilience initiative. It's really based on 3 principles. One is on equity, solidarity, and human rights. What I'd like to do is then to ventilate this within the four 4 areas of the Joint Vision 2030, which will be discussed at the summit on the 24th and 25th of November in Luanda under the Angolan presidency of the AU. So I call these the 4 Ps, which are under the joint vision. The first P is people. That's central, and health is central to the well-being and to the for our citizens. We can see the average age in Africa is 19. The average age in Europe is 44. So we can also see the migration and mobility implications of that. Europe will need and require jobs and prosperity. That leads me to the second P, which is prosperity. We have now invested 150 billion euros under the Global Gateway Package, and that includes initiatives for health. The third P is peace, I'm sorry. We can only have peace and security if we have health, which has been done in an equitable and in a way based on solidarity. And the last P is the planet. Our Fitsum, I think you also alluded to the fact that we can now see in the geopolitical environment changes that are impacting how much resources are given to health. So I'd like to highlight 4 areas where we are working, where we hope to work within this new initiative. And I would call them the 4 M's. The first M is manufacturing. And there we can see that the EU has backed by over 5.4 billion under the NDICI Global Europe Initiative and 1 billion through Horizon Europe for health research and innovation. So the goal under the MAV+, the MAV+, is to build local capacity to produce vaccines. So I think we're quite proud that we have been supporting South Africa, Senegal, Nigeria, Rwanda, and Ghana. And this should also always be seen through African solutions for African problems, that we are now supporting the continent to achieve its goal of producing 60% of vaccines by 2040. That's the first M. The second M, I would say, is mobilization. So we've been mobilizing to help 10 million women for sexual and reproductive health and rights through initiatives of 1.5 billion. We're bringing together 10 EU member states and also regional organizations like ECOWAS and SADC. We're also working under the Safe Birth Africa program, which is now a Global Gateway Initiative flagship for saving lives by improving access to postpartum care for 5 million women. We've also been mobilizing on the Global Polio Eradication Initiative. And the EU, we have put down, I'm sorry to give you so many facts and figures, but I think it's important to show that these are not just words, but also initiatives and actions. So under the Global Polio Eradication Initiative, we've put 560 million across the 2 funding cycles. And also under the Global Fund for Communicable Diseases, we put 715 million for the period 2023 to 2025, which is a 30% increase. So we have, I mentioned manufacturing and mobilization. Another area I think is important is mental health, third M. There we're looking at tackling the quiet crisis that we face of non-communicable diseases and mental health, especially for both parts of both continents. We have an initiative for Healthier Together, and that with a comprehensive approach to mental health, where we've mobilized 1.3 billion euros. We're working with the WHO and UNICEF on toolkits for youth mental health and funding projects for prevention and awareness. We're also looking at nutrition, which is also a foundation of health, where we have pledged by 2027 3.4 billion through the Nutrition for Growth initiative. My last M is multilateralism. I think we are cooperating now with South Africa as the chair of the G20. There will be a summit taking place in Johannesburg just at the eve of the EU-AU summit on the 22nd and 23rd of November. We are also looking at working together with, of course, the African Union, the WHO, with UNICEF, and we have with the WHO the Universal Health Coverage Partnership and the Lusaka Agenda. We're also cooperating, and we're proud to say, leading on the WHO Pandemic Agreement and the new International Health Regulation. So I think under all of these areas that I mentioned, manufacturing, mobilization, mental health, and also on multilateralism, we hope to be working hand in hand with the African Union. What I'd say in conclusion, I think this conversation should not just be driven by summits and ministerials, but also by engagement between our civil society and youth organizations and also with our private sector. So that's why at the summit in Lusaka, that will be preceded by a meeting of CSO and youth representatives from both Africa and Europe. We will be meeting in Lusaka on the 20th and 21st of November. And I hope that your organizations will also be connected both through the AU side and also the EU side. So that's one track, the CSO youth. The second track is the private sector. So we will be holding the Africa-Europe Business Forum, taking place on the 24th of November, also in Lusaka, as a meeting bringing together CEOs from both sides. What we want to do is also to bring representatives from CSO and youth to discuss this and present their findings to the leaders on the 24th and 25th of November. And I think that will be a good moment. As you mentioned, this is the 25th anniversary, silver jubilee of our relationship, which started in Egypt, in Cairo in the year 2000. But as we go to the next decade, I think we need to work in a spirit of, we need to discuss together, create together, and hopefully enjoy together the fruits of our labors. And I think health will be central to that. And we hope that your organizations and the voices that you and the messages that you carry will be helpful as we prepare for the summit, and also importantly as we move forward and look at some of the deliverables as we move towards 2030. So thank you again, and I look forward to the discussion and the presentations by colleagues. Over to you.
Fantastic. Thank you so much, Asad. Some very interesting points there, I think, on the importance of health equity and health as a human right within the partnership. It's always nice to get a bit of an institutional perspective and to hear that the EU is committed to these principles. So I'd like to move on now to our third speaker, Spring. So Spring Gombe is a senior fellow for health at the Africa-Europe Foundation, which is a bicontinental and multi-stakeholder platform which works to strengthen the partnership between Africa and Europe through dialogue, strategic analysis, and joint initiatives. So she was a founding partner of Market Access Africa, which partners with the public, private, and third sectors to design and deliver transformational healthcare solutions for Africa. She's been advocating for global health for over 20 years, both at the policy level and through program managements, with a particular focus on vulnerable, neglected, and minority groups. So now if I can just come over to you, Spring. So we've already had the joint vision for 2030 mentioned a couple of times since we started, which as we know was adopted at the AU summit, at the AU-EU summit back in 2022, which is committed to supporting the fully fledged African health sovereignty. Now, this promised at least 150 billion euros as part of a package for investment, health, and education, which I think Asad just mentioned as well. And can you maybe tell us a bit about what the expectations are for the health sector in this year's EU-AU summit next month?
Thank you, Rowan, and thank you very much for this kind invitation to join you. I don't know if I'm going to speak so much about expectations as about aspirations. And those aspirations are being inserted into what is already a very sort of turbulent architecture in global health. I agree with Fitsum and Asad that health, first of all, is an end in itself and it's a human right. It's an end in itself. It is always and should remain people-centered. But, or maybe I should contextualize that a little bit further to say that I see the need for the Africa-Europe Foundation pushes for investment in people and the services that care for them today, starting at the primary healthcare level. And we're also see the need for investment in the systems that provide services at that level and improvement of the efficiencies in those systems. But we also need, if we are going to take advantage of this singular, extraordinary opportunity to reshape the architecture of health in our minds and in practice, we need to start thinking about how we integrate approaches that cover discovery, design, movement, policy around the services that we need both today and tomorrow. Asad mentioned, keeping vaccines in the forefront of our minds and thinking about manufacturing and autonomy as a way of contributing to resilience. That is important, and that should be retained. However, what continues to frustrate me about the way in which we look at health is first, and especially on the African continent, is that we continue to locate it within development as a development agenda priority. More recently, we talk about it as an investment, but we still continue to talk about it as an investment in the individual or in systems that serve the individual, and rather than think of it as a strategic pillar, in fact, a scaffold for anything that we wish to achieve as humanity, whether at the nation state, the regional, or at the global multilateral level. I think we're also quite short-sighted in our approaches. So when we design responses to architecture, we look at lives and systems as they occur now. So for example, we will look at neonatal mortality in children and try to address it. That's very important. I don't contest that. But in looking at neonatal mortality, are we looking at what happens to that child once they are grown and aged? And should we start thinking about that on the African continent now, rather than at the point that they become old? And can Europe provide, from its more advanced age of its population and its head start on becoming aged, some support and intelligence to Africa to make Africa better prepared? Conversely, are there things that Africa can do to leverage the affinity of youth for innovation and creativity to help both Africa and Europe think about what new models and what new tools and systems might look like? And I very much welcome to that end, Asad's sharing with us that the European Union and the African Union in their preparation for the summit will be engaging with civil society and youth. So we want reliable primary care, and we want a steady supply, and we want to see our leaders reiterate their commitment to that. We do also want to see their sustained interest in research capacity, creating regulatory pathways and advancing those. And we want to see also agility to pivot when threats change. And so to that extent, Ursula von der Leyen's indication that she wants to see Europe lead on global health resilience is very, very welcome. However, I would like to see a little bit more of partnership expressed in that. I know the details of that have not been shared with us, but it would be welcome to appreciate that two continents that at their closest are separated by only, I think, 14 kilometers, work together, work hand in hand to design whatever systems are relevant for global health resilience. I think we need, and I would like to see from the summit, and a signal has been sent from President Mahama of Ghana of a new pragmatism and a focus on hard numbers. We know that across advanced economies, more than 1 in 10 jobs is in health or social care. We also know that those are the jobs that are thought of as decent jobs, jobs that provide both service and value in its social and economic forms, and also contribute to the wealth of the nations in which they are practiced. If you take Switzerland, chemical, pharmaceutical, and life science products make up about half of exports. In Germany, roughly 93% of medical technology companies are small and medium-sized enterprises, and this is what drives the success of Germany's economy. This is the middle layer that I would like to see Africa advance and Europe support, knowing that the decision that has been taken by Europe at home to position health as a strategic sector and to defend it as a strategic sector should be reflected in its partnerships. What's good for us is good for others. That is not to say that African countries should mirror blindly what is being done in Europe, but should adjust that for their individual and collective contexts and proceed accordingly. I think for all of us in this conversation, and for all of us who have been in global health for a long time, this is a difficult moment personally, and one that we may not want to acknowledge the degree to which it affects us. Our jobs are on the line, our own security and futures are on the line, and we are being asked to define and design solutions based on an unknown future. And our instinct, and it is understandable, is to look for solutions in the what and the how that we already know. And the challenge for us is to think about health far more broadly than we do. When we talk about health opportunity and economy, we are definitely talking about community health workers and frontline workers, but we are also talking about actuarians and analysts and managers and engineers and diagnosticians and manufacturers, etc. And in countries with strong systems, health already employs 1 in 10 people on a continent where the median age is 19. And one of the major contributors to ill health and ill mental health is the lack of opportunity for those 19-year-olds to see a future that is one that is a win for them, that they can look forward to. I think that we should start to really push ourselves to expand our way of thinking and get that signal from our leaders as well, that when we talk about health and the health economy and the health sector, we're not just talking about building more clinics and providing more services at the end of the health ecosystem. Those are important, delivery is important, but we're also looking at why health is so central to our well-being, economic, social, etc., and really taking account, using our brightest minds to design systems that think, if you like, in 3-dimensional chess, right? When we talk about the countries in which we invest in Africa, and I think there's a kind of unfairness that faces the African continent. In Europe, there are 27, or at least in the European Union, there are 27 countries, and those countries leverage their strategic advantages and are allowed to do so. On the African continent, we speak of all 55 and try to find solutions in Nigeria for South Africa and so on. And while I understand that solidarity is a really important element of ensuring health resilience, solidarity does not mean a lack of differentiation. The European Union works with key countries to develop very robust infrastructure in Africa. So we've talked about South Africa, Nigeria, Rwanda, Senegal, and Ghana. And if we take those countries alone, they are completely different in size, aspiration, politics, etc. We're glad that the European Union intervenes on their behalf, but I would also like to see things like Nigeria thinking about what happens elsewhere in the continent and where it, as a keeper of its continental brothers, can provide support, but not necessarily provide it in a way that is identical with its own internal ambitions, either for industrial development or development of its health sector. So in short, I'd like to see matching of capabilities across the African Union, European Union axis, and backing of those models that emerge, even if they are very different from what we know, not being afraid to test them, not being afraid of failure, because it is from failure that then the robust solutions emerge that are for our common benefit. I'll stop there.
Absolutely. So thanks very much, Spring. It's fascinating. I think we'll have the time to maybe come back to a couple of these points during the Q&A. Moving on now for the sake of time. So I'd like to move to our fourth and final speaker. So Dr. Catherine Kyobutungi. She is the Executive Director of the African Population and Health Research Center, APHRC, which is the continent's premier research and policy organization, which is committed to evidence-informed decision-making. She has a medical background and is a trained epidemiologist with research interests at the interface between NCDs and health system strengthening. And so, Catherine, you recently published a paper on rethinking the global health architecture in service of Africa's needs as part of a series commissioned by the Wellcome Trust. Now, through your paper, we're able to envision a reimagined global health architecture, which is more centered on African agency, on equity, which we've already spoken about, and also on systemic reform. Now, the upcoming summit could be a moment to align, shall we say, political will, so between the European Union and the African Union. In your view, what kind of commitments, what specific commitments should the EU and AU adopt at this summit to initiate the principles you outlined, such as priority setting? Just taking this one as an example.
Thanks a lot, Rowan, and thanks to the previous speakers. I was nodding my head because most of what has been said actually resonates a lot with the proposals I made in this paper about reforming the global health architecture. And as you may or may not know, there were 5 papers, and mine represented the African region. And I was very intentional, even in the title. And what I was intending to communicate is that we need to first understand for what the reform is. And I think from where Spring ended, it's very easy to run towards certain things because they are familiar and they are convenient. And almost all the discussions around reform are focused on where will the funding come from, domestic financing. And I'm saying we need to first ask ourselves for what is the reform? What are we reforming? What do we want to see at the end of this reform process? Because the reason the system is being reformed is because it's not working. And so when we focus on the reform itself, without asking ourselves, what should a functional system look like, then of course we might miss this huge opportunity that has been presented to us. So I'll first briefly talk about the paper and then say, of course, what commitments come out of that. And I'll talk about 2 things. One is, much as it's not explicit in this paper, I subscribe to the system thinking approach of change. And not just about the systems and structures, but also the mental models, how we think. The reason we have a global health architecture that exists the way it is a function of the mental models that exist within us and within the players in the global health architecture. And so people think a certain way, and as a result of what they think, then they act in a certain way. And then we end up with this system, which is skewed, which is distorted, which is not sustainable, and which can collapse, at the overnight, literally from Friday to Monday, the system can collapse because there are huge underlying mental models behind that. So what I'm proposing is that we need to shift not just the structures and systems, but also the mental models among the players in the global health architecture. And fundamentally, the mental models, even within the African continent, need to change. So it's not just the global system, I'm putting that in quotes, because that's also a question mark. What is global? When I'm in Zambia and I'm Kenyan, am I global? I don't know. Because now there's an assumption that global is that thing that is far in the north. And if it's not in the north, then it's not global. So that's a mental model. And I think unless we start dismantling those mental models, then of course, as I said, we might miss this opportunity. So that's the first part. The second part is that right now, a lot of the reform is focused on supplying reform. And again, I think that's a function of mental models. So there's a process that is ongoing that is focused on supplying reform without asking whether there will be demand for that reform once it is ready. So we are cooking something and then we are going to supply it. And of course, African countries will take it. How they take it, how they use it, is a question mark. And so what I'm proposing is that we need to create the systems and structures that create demand on the ground. Demand for reform in the short term, but demand to sustain this relationship, a new relationship that is built on trust, that is built on dignity and agency on both sides. And you cannot do that without a strong knowledge system. And almost all the speakers have talked about this. You cannot do that without a strong knowledge system on the African continent. So what I'm proposing is we need a strong knowledge system, first of all, that will define what is a good health system for Zambia, for Rwanda, for Chad, for Niger. It's not the same. What is a good health system? And that is an academic exercise that requires a knowledge system to do some kind of theoretical modeling and all this and put it all together and say, okay, this is the best system for Uganda. And that takes time. And it can't happen without systems and structures on the ground to do that kind of analysis. Now, once that is done, Spring just talked about priorities. If priorities change, then we should be able to shift with those changes in priorities. How do you know priorities have changed? You have a strong data system on the ground that constantly provides information to every country that tells them your priorities have changed based on the epidemiological profile or whatever it is. And that's a function of a strong knowledge system on the African continent. So I'm not too concerned about where will the money come from. I'm concerned about us first defining what will the money be used for and what is optimal, what is relevant, what is sustainable, what is efficient. All those are questions that are a function of a strong knowledge system on the African continent. So what commitments? There are commitments, I think, to change our mental models and every time ask ourselves, why do we do what we do? Is this the right thing that creates agency? And asking ourselves to center agency and dignity in our decisions, not this power dynamic that creates dependency, that is paternalistic. So part of the change is in our heads about our mental models that guide what we do. But the other one is more structural, that we need to commit to invest in African systems and African knowledge systems, whether it's academia, whether it is research, whether it's civil society, whether it's the media. But we need to invest in African systems that are going to provide the knowledge in the short term and are going to sustain the post-reform. Once the reform is finished, then what? We need to sustain this relationship where Africans can say, this is our problem, and these are the possible solutions because we have evidence to show that this actually could work. And in a way, in terms of dismantling mental models, I would say one last thing, which also based on a strong knowledge system. If you look at the global health initiatives, there is concern that if you take away the global health initiatives, all the gains we've made in health may go. We don't know that. But it's possible for somebody to sit down and do an analysis that says, if you invest in X, Y, Z, perhaps our vaccination rates are going to stay high. Perhaps our maternal, newborn, and child health mortality is going to stay low. We need that information. So if you break the vertical programs and invest in the foundations of the system, are we going to maintain the gains in all the countries? And that's a function of a health system. Perhaps it might help to break some of these mental models about our fixation and our fear of letting go verticalization. I'll stop there and happy to take questions and part of the discussion. Thank you.
Fantastic. Thank you so much, Catherine. I see we already have some questions coming through in the chat, so maybe we can get to those later. I see that there is already a question on linking the opportunities presented by the summit to the broader discussions on the global health architecture. So I'll probably be coming back to you on this, Catherine. Now I would like to come back to you, Fitsum. So as we already mentioned, 2025 is an important year for the partnership. So we're coming up to the 25th year. The anniversary. Now, maybe you can tell us a little bit on about what meaningful African Union leadership and a health pillar would look like to you, and maybe also, I think it was Asad who mentioned earlier that we shouldn't just be focused on the ministerials on summit, but also look at the process more broadly and look at the bigger picture. So maybe you can tell us, looking beyond the summit, what concrete shifts you would like to see in how the EU and AU work together to ensure that African priorities actually shape the partnership's future health agenda. We've already heard a few words from Catherine about how to create agency, this kind of thing, but I wanted to come back to you in case you had something to add.
Thank you very much, Rowan, and I would really like to appreciate all the speakers that really also put a very good highlight on partnerships, collaboration, and also the importance of equity within health systems. I believe the first one would be really to look into how we can further strengthen health systems, especially on the continent in Africa. We have been working to strengthen health systems for a long time, maybe even to dating back to some of the finance commitments we have on the continent, the famous being the Abuja 15% declaration. However, we only have like 2 or 3 countries who have maintained that physical commitment to allocate 15% of their budget to health, and other numerous commitments on finance and other things. And coming back to the reality aspect of it is that there needs to be a deliberate approach in terms of this fiscal and also other health commitment frameworks to make sure that they speak to the country context, they speak to the narrative, and also make sure that there is a progressive alignment moving forward. So whenever we are having these kinds of commitments, it's very much important to build on country context, regional context, to make sure that this partnerships such as the AU-EU bear fruit. The other one would be, again, I would like to reiterate on the international financing as well. We need international commitment, especially through increased international resources for health financing. Yes, I've mentioned this should be catalytic and should not be a long-term solution to our health service delivery gaps or health system gaps. However, they are quite important in bridging the gap to make sure there is a sustainable and gradual transition from such partnerships, such as maybe through ODA or any other bilateral international partnerships that we're getting. The other would be, there should be a very strong support for AU-led initiatives, including the Africa CDC, AUDA, and NEPAD, who are doing quite a lot in terms of shaping the policy space, shaping the implementation space on the continent. The new public health order of the African CDC, and also now currently coming up also with new financing approach and models, and very much so also the regional manufacturing agenda, which is at the center of Africa CDC. And we are also, I'm really glad to hear Asad about the approach of by 2040 to make sure that Africa produces around 60% of the vaccine on the continent, which is a very applaudable support that we need. And now even some number of countries now coming to level maturity 3 on the African continent is promising, however, needs more technical and resource support moving forward. I would also like to really touch on approaches being more preventive than really working on curative approaches. We need to be very much very cognizant of the fact that prevention is, it's a well-known fact that prevention is cost-effective than really addressing the challenges. So then how do we do prevention to be more effective is really engaging civil society and communities in our intervention. The best examples of maybe, I can say Ethiopia, of having community health workers on the ground, which has really, really helped in terms of preventing and having a very bold health outcomes. This can be replicated in other parts of the continent, and also other successful studies or case studies can also be somehow replicated moving forward. We need to really address the death situation as well. EU is also leading, especially there are good examples between Germany and Indonesia, and I believe one EU member state and also Cameroon in terms of restructuring death and making sure that the death restructure also benefits health. So death to health swaps are very, very important. And these partnerships really, really needs to focus on that, like revisiting those terms, conditions, and making sure that we be very much intentional on the death restructuring issue. Looking into also, we quite understand that our regional approach and regional coordination on the continent, according to the civil society, is not really that strong. And within the AU, we have 55 member states, meaning that we have 55 ministers of health, 55 ministers of finance as well, which for us is also making sure that the harmonization or the coordination are being not well maintained. So we are not really against the political structure of these approaches, but there should be a more coordinated approach, a harmonization approach. And this also benefits equally EU in addressing the African continent in a well-structured and harmonized matter, rather than really going to the spaces. So at least building up the regional economic communities, making them further stronger in terms of addressing the collaboration and the harmonization problem that we're facing. So if we at least have this kinds of 5 or 6 structured mechanisms on the continent, that will be very important. And this is very much actually a call for both AU and the European Union to make sure that we have this engagement. Finally, I would like to touch on the point that civil society and communities are naturally excluded from such kind of engagement, and we need to be very much also aware of that. On this point, I would really like to appreciate the European Union and also our counterparts in the European Union, such as GHA, which time and time again have been very much reaching out to understand the perspective, the narrative, and what we also think as the African CSOs on this engagement. This needs to be very much improved from the African Union side. We believe it's not intentional. We believe it's something that is being oversighted, and we need communities and civil societies to be part of these consultations to begin with, but even moving forward, very much also making sure we form at least the decision-making processes. Finally, the need for international, the reform that we're having at a global level on health structuring should be very carefully handled. It shouldn't be considered a retreat from international solidarity. It shouldn't be considered a retreat from multilateral principles. However, even to be readdressed in a way that it's more effective and brings sustainable outcomes. Thank you.
Fantastic, Fitsum. Thanks a lot. You've come back to quite a few points that we've mentioned already. It's fantastic to make these connections. So we are running out of time. So I'm going to move on now. Coming back to you, Asad. So we've spoken, a bit about the importance for new approaches, for the end to business as usual, the need for new systems that take into account the challenges that we've discussed already. Now, in this context, I would like to come to the Accra reset, which was an effort to declare an end to the era of, as I said, development as usual, and a push for the creation of new governance, new business, and new financing models, which was led by Ghanaian President John Dramani Mahama, which has been framed as an important moment for rethinking Africa's partnership with global actors. Can you tell us about how the European External Action Service and maybe the EU more generally view their role in engaging with this initiative or other similar initiatives to ensure that the priorities that are raised by African partners, including, of course, those we've just heard, are included in the next phase of the EU-AU partnership? And if I could ask you to be brief, because we're running out of time, that would be fantastic. Thank you.
Thank you so much. I think the Africa Reset, it's about reshaping the AU-EU partnership, and I think this is actually catching the zeitgeist of both sides. I think we cannot be in a donor-recipient relationship. I think it needs to be based on mutual respect, mutual benefit, and mutual accountability. And I would look at four areas. The first is 4 C's. The first C is commitment. I think we need to get political commitment, and we need to get financial commitment from our leaders at the summit. And second is looking at collaboration. I agree, we need to collaborate at the community level. There are 55 different Africas. There cannot be one Africa approach. I think we have to work closely together at community, CSO, business, and country level. And I hope through our delegations, through the regional economic communities, and also with the AU Commission and the Africa CDC. Third C is connectivity. What about looking at digital connectivity, using digital health, using AI, fighting against misinformation in social media? I think this could be a new area where we can engage in. And the last one is regarding cost. I think if we look at the numbers, in Europe, we spend 9 to 10% of GDP on health. In Africa, it's around 5%, half. But if you look at every euro invested in health leads to 4 euros in economic growth. So I think this should be an argument for us to be investing and moving away from donor to investment logic. Last point is, if you look at the workforce, 10% of the population in Europe is engaged in the health sector, in the health ecosystem. That means that there's a huge potential for us to be working together and investing in this, both for Africa's health itself and also for its opportunities. So I think I would end here. I think we need to change with a reset. We need to change not only the hardware, but also our software, both on the European side, but also on the African side. And that will demand, I think, more imagination from our leaders and more accountability. And through accountability, I think the CSO and youth can play a key role. I have a document here which I can share later, the link. It's 56 pages of all the actions that have taken place since the last summit. And we will be if there are any concrete suggestions that you and your colleagues can present as policy recommendations, those I think would be useful to be coming ex ante, to be coming now at this stage, that can help us as we prepare for the summit. And after the summit, there will be a summit statement and a declaration of deliverables, and there will be a joint monitoring report that will be adopted by leaders. So I think it would be also useful for your organizations to work upstream of the summit, but also downstream of the summit, and to keep this conversation going and making sure that health remains a high priority on the radar screen of both the EU and the AU. Thank you.
Thank you very much, Asad. It's really nice to have these conversations and to see the European institutions being so open to input and discussions with civil society organizations, not just with us here in Brussels, obviously, but also with those in the African continent. So we are running very short on time, so I'm going to move ahead. So back to you, Spring. So we've already had some discussions on the importance of the existing financing gaps for sustainable development, for health. Now, in the middle of these discussions, we had the Africa Think Tank Summit, which took place earlier this month, which spoke again quite a bit about the importance of sustainable and innovative financing for the health sector within the partnership. So can you maybe tell us from your perspectives, what are the key outcomes or insights from the summit that could help maybe advance EU-AU collaboration on this topic? And again, if I could ask you to be brief, because we are running short on time. Thank you.
Thanks, and sorry, I thought I had turned my microphone off so people heard me typing. I apologize for that. I'll be very brief. I think what the summit would like to see, and I think Catherine already alluded to this, is good data that supports the decision making around how and where investments are to be made. So that's the primary thinking. And then it was a think tank meeting, so it is about observing what is happening in the entire ecosystem of health, but also beyond health, that has an impact on health, that we should start to incorporate into our forward planning. So data for forecasting, but also strategic intelligence for forecasting as we continue the collaboration between the continents. That's it.
Fantastic. Thank you so much, Spring. Now I'd like to come back to you, Catherine. So maybe building on what other speakers have shared already around, the importance of financing, leadership, accountability, and given the focus that your organization places on research and data, maybe you can tell us how you see the role of evidence in guiding the next phase of AU-EU collaboration, particularly ensuring that the priorities discussed today influence in measurable outcomes and also in true population needs. And again, if I can ask you to be brief so that we have a couple of minutes for a Q&A. Thank you.
Yes, so I think I would say that we need to look at two different types of evidence. There's evidence in terms of analytics, what's the disease burden. There's evidence in terms of modeling. We've not even talked about how does the future look like when climate change kicks in, when demographics kick in. You heard that the median age in Africa is 19 years. So there are all these things about health systems of the future. How do they meet demographics? So there's that kind of evidence. But then I think importantly, it is the connection. It's not just the evidence itself, it's the connection, because accountability is a function of evidence being available for people who make decisions and people who are affected by decisions. So we need to look at not just the evidence itself per se, but also the frameworks that allow evidence to feed into decision-making processes, but also feed into the public psyche, so that accountability then can happen. So so that's how I see that. And what I would think is that we need to look at if we're able to package all those bits, not just the evidence, the hard evidence, but the other maybe soft parts of evidence. I think that would be useful to see how this process moves forward.
Fantastic. Thank you, Catherine, and thank you again for being so concise and so precise in your intervention. So we are just about at time, but I would like to open the floor for some questions for our speakers. We've had several questions come in through the chat already, and I see that some of our speakers have already kindly been providing some answers. So I have a question here for you, Catherine, from someone in the chat who says, you've spoken about how these health systems and resources can collapse as soon as the partnership declines. And so how does the EU-AU partnership think of a long-term process to create a sustainable health system for African countries that will be able to stand on its own set of legs for the next 10 years? I realize that's a big question.
Yes, I think maybe in a way there's a certain theory of change behind building strong country knowledge systems, and making sure they are connected. Because part of the reasons why the investments in health or investment in other sectors sometimes can be in a way that maybe we don't think should be, is because there's not good connection between academia and knowledge producers with knowledge users. So if we're able to connect to make these strong bonds, so that government is constantly seeing the value of science and the value of knowledge, and they have these people who are behind them to show this is the right place to put your priorities, then that's one way in which you can actually ensure that the system is self-sustaining. I think I have a strong belief about the efficiency gains that are possible in this new system. If we're able to operationalize primary healthcare, if we're able to invest in health-producing sectors, not just focused on healthcare, if we're able to integrate even within healthcare, there are lots of ways in which you can look for efficiency gains. And if we're able to actualize those efficiency gains, then of course the lost funding, we don't need all of that. It's possible that our own funding, our domestic funding, can sustain a system that is focused on prevention, on primary healthcare, on health production, and not on these other things that have been sort of bloated and are not dealing with the pipeline of ill health. So there's an argument that can be made about efficiency. And if we're able to have a knowledge system that supports efficiency, then it's possible that in future, actually, our systems may be self-sustaining.
Fantastic. Thank you so much. And so I see we have another question in the chat, which is not addressed to anyone in particular. So I will be looking for volunteers among our speakers, which is, how can the EU-AU health agenda link with the discussions on the wider reforms of global health architecture? So Catherine, I'm sure you have a lot to say about this. So I will come back to you if we have no volunteers among our other speakers. But we had, Asad, I think you mentioned earlier the connection between the current discussions and the different global health initiatives. So I don't know if you want to come in on this one.
I think the importance is that when the multilateral system is being eroded by some who helped to set it up, I think the EU and AU have a mutual interest in making sure that we uphold the multilateral system. So just in a few days, on the 5th of November, we're going to be holding the EU-AU Health Partnership High-Level Steering Meeting, which is taking place in Pretoria in South Africa, in the presence of the Commission, the EU member states, the AU Commission, the Africa CDC, and the leitmotif of this is, I quote, to champion global health and renew the AU-EU health partnership based on the principles of health equity, security, and resilience. So I think if we are guided by that, I hope that we can work together as two partners holding up the multilateral system, which is now facing stormy waters. Thank you.
Thank you very much, Asad. So we have another question that has just come in for you.
Rowan, could I just add? Could I just
yes,
add
go
a little
ahead.
bit to the end of that? Asad,
Sure.
well, that's very welcome. And just to say, 55 plus 27 can do a great deal towards setting soft norms for how multilateralism can be approached in the future.
I agree fully. I vote for spring.
Fantastic! It's really nice to see these different interactions and to see people reacting, bouncing ideas and so on off each other. So I just had another question come in again for you, Asad. You're clearly very much in demand. So this is coming to the debt burden, which, as we know, is a significant challenge for African countries when they're trying to finance their own health systems. So the debt burden has been mentioned as a critical issue for African governments. Now, the participant would like to know in what way this discussion is being taken into account by the Commission, particularly in order to accelerate new financing schemes like Debt for Health, which has already been mentioned earlier.
I would turn to the excellent publication that was made by the Africa Europe Foundation with the Mo Ibrahim Foundation on financing for Africa. And I think maybe Spring, if you could share that in the chat. That was something that was presented to our member states by the Africa Europe Foundation to the COAFRA directors, and that found a willing audience. So I think Africa is a rich, poor continent. Africa is sitting on these huge human resources. 1/4 of humanity will be African by the middle of this century. It's sitting on these natural resources, critical raw materials and others. But if we look at the numbers, the African diaspora is sending 100 billion euros every year back to Africa, which is greater than foreign direct investment and ODA combined. That is, in a year and a half of diaspora remittances, that's equivalent to the Global Gateway over 7 years. But it's also a sensitive issue. Around 100 billion is leaving Africa through illicit financial flows and corruption. Some of it's ending up in European banks, but not only. So I think Africa needs to take a stronger lead of this within the African Union and also with the regional economic communities and also African countries. So I hope that this will be an area that we can work on together. But I would turn to this Financing Africa report, which has a number of policy recommendations, which I hope that we can take together, and also build on the reforming the international financial architecture summit that was taking place in Spain, in Sevilla recently. And I think, as you mentioned, Spring, 40% of the EU and AU, we are the world's voice. So I think we should also speak up with one voice on these critical issues. Thank you.
Fantastic. Thank you so much, Asad. I don't know if anyone wants to react to anything that has been said in the last few minutes. If yes, please feel free to jump in now. Yes, go ahead, Catherine, briefly.
Yes, I wanted to briefly talk about the reform, the global health architecture reform process. And I posted something, but I see it's only going to the panelists, that AMREF Health Africa is leading what they call the regional dialogue for Africa around and seeking input into the future, the global health architecture. And similar processes are going on in other parts of the world, and then there will be like some kind of global convening. So that's a very practical way in which to explore what is possible. I think they accept written submissions, and in a way it could be, this partnership could inform or could align. Yeah, so either is fine. And I think it's something which is, I think, would gain traction to some extent, and therefore having some kind of alignment or input is something which is going to be very useful. Yeah.
Thank you so much, Catherine. We are a couple of minutes over time already. I wanted to offer all of the panelists the opportunity to maybe give us any last words, any reflections, what are your takeaways from the discussions we've had, and then I will move to the closing conclusions. I don't know if anyone wants to start. Maybe Fitsum, we haven't heard from you in a little while.
Thank you very much, Owen, and I would like to thank every speaker and also our very esteemed participants who have been very active in this conversation. Finally, then would my closing or my final word would be to really focus on the last mile. We have few years to round up the SDG, and we are not certain what comes after the SDGs. But within the time left, let's make sure that as international community, support what we need to really achieve. So international cooperation and solidarity is very much important. I would like also to build upon Dr. Catherine's point on efficiency, which usually is overlooked. So as much as we are demanding accountability and transparency and solidarity from international partners, we also need to look in-house and make sure that efficiencies are very much capitalized on. Otherwise, even any catalytic support and any sustainable models that will follow without efficiency will still be a leak from the system. Thank you very much.
Thank you, Fitsum. I don't know who wants to go next. Perhaps Spring, quickly, your final words, your key takeaways from this discussion?
Yes, thank you. Mine will be to continue to apply Catherine's challenge to all of us, which is to think about our mental models and how that informs our thinking, really to push myself very hard to engage with that. And the second is to think about policy efficiencies and push for those. When we're entering a multipolar era, it means for policymakers being pulled in multiple directions and dispersing energy, perhaps not as well as we might. And so to the extent that we can constitute a defense of multilateralism and a coherence in policy thinking in the interest of efficiency and all people, that is our ambition. Over.
Thank you, Spring. Maybe now back to you, Asad, for some closing words, and then to Catherine.
3 I's. First is information. It should be fact-based. Second I is integrity. I think this is solidarity, and we have to avoid double standards. International law should apply irrespective of the color of your skin. And the third I is imagination. I think we need to put ourselves, think of some of the issues that we will be facing, or maybe our children will be facing. So information, integrity, and imagination. Thank you.
Thank you, Asad. Back to you, Catherine, for your last few words.
Yes, I usually have like a favorite phrase that lasts for about 3 months, and my current one is that the best way to create the future, the best way to predict the future is to create it. So, and it's good to be here and to see like, it's like, this seems like a different moment, to be honest. And I think there's been reform and reform and reform and reform. Maybe it's my age, but I see like there's a lot of concurrence and convergence around certain things, and like they're like common threads that every conversation about reform go through. So mine would be like a call that the best way to predict the future is to create it. So the future that we think we want, we have to work for it and we have to fight for it. And then hopefully we look back and say, yeah, finally we cracked it. So that this is not just another reform process that doesn't lead us anywhere.
Fantastic. Thank you, Catherine. I don't think we could have asked for any better closing words. So we are at time. So summarizing the discussions we've had in the past hour is, I would say, challenging, but I'm happy to give it a go. So we've heard, I mean, there's clear consensus among all of our speakers on the importance of health as a priority within the EU-AU partnership, but more importantly, there's emphasis that's been placed on it being an actual human right and an end within itself, not just a process towards something. We've discussed the importance of accountability, of efficiency, and the importance of meaningful reform, which takes into account actual needs, with differentiation between countries and regions. We've spoken quite a bit about the need for a new mental approach, not just a new systems approach. We've discussed the importance of creating agency to ensure that, these new approaches actually take root, to leave paternalistic and, shall we say, more charity approaches behind. We've discussed the importance of developing the health sector in Africa as a strategic sector, on the importance of adapting to changing priorities, particularly in the context of the last phase of the SDGs. So I think we have quite a few takeaways. We have quite a few things to think about in the lead up to the summits. I would like to thank all four of you for being excellent speakers. Many thanks to our participants for joining. Again, I know it's a busy period. On behalf of GHA and on behalf of Action Africa, if I may, Fitsum, I would like to thank everyone for joining. As mentioned earlier, the joint brief, which was presented earlier in the discussion, is now available online. It's on GHA's website. I believe the link has been dropped in the chat already, and the QR code was on the screen earlier. This session has been recorded. It will be made available online later if there's anything that you want to come back to that you might have missed. So in summary, thanks again, everyone, for joining. Have a great rest of the day, and I hope that you found this informative.